Keloids are usually induced by trauma and commonly follow ear piercing, burns, scalds, and surgical procedures. Then the resulting keloid is larger than the initial area of trauma to the skin. Certain individuals are predisposed to keloids. A familial tendency or the presence of foreign material in the wound may have a pathogenic role. Keloids result from an abnormal fibrous wound healing response in which tissue repair and regeneration regulation control mechanisms are lost. Collagen production is 20 times that seen in normal scars, and the type 1 to type 3 collagen ratio is abnormally high in keloid. In keloids, tissue values of tumor growth factor and platelet-derived growth factor are elevated. Fibroblasts are more sensitive to their effects and their degradation rate is decreased. When tumor growth factor and the platelet-derived growth factors are elevated, fibroblasts are more sensitive to their effects, so there is increased fibroblast production and also the degeneration rate is decreased. That is why it becomes exaggerated and increased. A keloid is a sharply demarcated, benign, dense growth of connective tissue that forms in the dermis after trauma. The lesions are firm, raised, pink to hyperpigmented, and rubbery. They may be tender or pruritic. Sites of predilection are the face, earlobes, neck, shoulder, upper trunk, sternum, and the lower legs. In both keloids and hypertrophic scars, new collagen forms over a much longer period than in wounds that heal normally. New collagens are produced for a longer period of time compared to normal wound healing in both keloids and hypertrophic scars. The differential diagnosis for keloids are hypertrophic scars. But in hypertrophic scars, it remains confined to the site of injury and gradually involves over time. Hypertrophic scars doesn't go above the site of injury, and hypertrophic scar doesn't persist long time. It involves over time. When we came to treatment, young keloids may diminish in size if triamcinolone is injected intralesionally at 4 weeks interval till acceptable size is reached. And large or old keloids may require surgical excision followed by intralesional injection or of corticosteroids. But surgical excision alone is not good. It may cause regrowth of huge amount of tissue when it is only resected surgically. So if it is large, surgical resection is done followed by intralesional injection of corticosteroids. Placement of topical silicone gel sheeting over the keloid for several hours per day for several weeks may help in some patients. Thank you for watching.